Well, federal cuts under DOGE have been sharp and deep and are now being felt across the metro, with thousands of workers receiving layoff notices just this week. And this is part of the Trump administration's plan to restructure the Department of Health and Human Services.
However, as 11 Alive's Molly Oak shows us, some of those who are doing critical research worry these cuts may not only be costly, but deadly in the long run.
These are human tragedies that are occurring, but we're also losing the expertise. We're also losing the workforce.
Evelyn Alansky was part of that workforce at the CDC.
I worked on a HIV surveillance project.
She was laid off Tuesday morning.
There's a good chance that we won't know the negative impact of this because the very people who would capture that negative impact and measure it are the people who've been fired.
Dr. Carlos Del Rio is the chair of the Department of Medicine at Emory University School of Medicine.
I'm old enough to have seen HIV when it emerged and how, it was people essentially dying and not having, not having any hope. And I've seen how research has really transformed HIV.
He's worried the cuts will not only put things on pause.
We're going to go back in time. We're going to go back to, HIV the way it was before. New infections will continue to rise again. And, transmission will occur, deaths will go up.
He says the cuts, which are intended to save money, will ultimately cost more, and not just financially.
These cuts are deadly, these cuts are inhumane, and these cuts will be impacting people. And unfortunately, some of the people impacted are the most vulnerable population.
Molly Oak, 11 Alive News.
Our thanks to Molly for that report. 11 Alive also checked in with the Georgia Department of Public Health. It confirmed 180 staff members were laid off, most of which were COVID-specific contact tracers. DPH also told us certain federal COVID funding sources were terminated, which equated to more than $330 million.